Hi, this is Austin Nakatsuka, and this is the haptic flange scleral fixation technique that was essentially invented by Yamane. Essentially what we're doing here is loading the haptics of a three-piece IOL lens into a 30 gauge needle, or we use a 30 gauge TSK needle with thin walls, and essentially you're loading it into that um, needle, which is then pulled through the sclera through sclerotomies that are made obliquely. And then we melt the ends of the haptic with a low temperature cautery that creates a little flange that basically holds it into the sclera, and you implant that into the sclerotomy and it's just held there and you don't need any sutures for it. So this is my technique for it. I use about a 2 millimeter marking away from the limbus, and essentially you are making tunnels on both sides that are about 2 millimeters apart, 2 millimeters in length of the sclerotomy tunnels. And we are placing an anterior chamber maintainer. So that's the difference between doing this versus posterior, is I'm putting an anterior chamber maintainer, so I don't have all these sclerotomy ports all over the place. I'm using a 30 gauge TSK needle, and I'm going about 2 millimeters in and creating a little oblique tunnel there. I'm injecting my lens, which is then loaded directly into that needle, and I use an MST micrograsper to load it into that needle. I externalize the haptic, and then I go ahead and grasp it and I melt it with a low temperature cautery to create a little, we call it a flange, or a little button there that holds it in the sclera. And then I do so on the other side as well, and we're running that about 2 millimeters before turning into the eye with the 30 gauge TSK needle. It's thin walled, and then the haptic is loaded into that needle and then externalized outside of the eye, just like so. And then we go ahead and melt that side too and create the little flange that holds it in place. The lens is nicely and well centered, and that's how we scleral fixate a lens to the eye with the flange technique.